Hi, folks, and welcome to this week's SoCal Prep Report. I'm Carlos Pena, and today in Korthuis Corner, I have Dr. Edward Korthuis. Welcome to the show, Doctor.
Thank you.
How are you doing today?
I'm doing very, very well. Thank you.
Now, we're here today to talk about health, in particular, bone and joint alignment.
Okay.
Now, how important is that for a young athlete?
Well, whenever you have athletes, the biggest thing with any athlete is their ability to perform. And when we talk about sports, being able to perform 100% versus 98% could be the difference between first place or second place, or making a team and not making a team.
Right.
And where chiropractic comes in, our whole goal with chiropractic is to keep and align the body to where it can function to its fullest capacity, allowing that athlete to be able to perform to their fullest capacity.
Wow. Okay, so you've been up here in the high desert, your office here, Life Chiropractic. What are some of the major injuries you've seen with young athletes?
Well, the biggest thing that we see with young athletes is muscle strains, joint pain. A lot of times it's because of a specific hit on the field, but a lot of times it could be an accumulative issue where we have a misalignment somewhere that's creating mechanical stresses in that area, and creating mechanical stresses over a period of time is going to affect the joint, the muscle structure, and so forth, and in the long run that's going to affect the athlete. And then once it affects the athlete, of course, they begin to have pain, discomforts, and whenever you have pain, discomforts, muscle strain, imbalances, and so forth, it's going to, again, affect their performance.
Now, what are some of the main areas that these young athletes feel this pain? Is it around the hip area or the spine? Or
the lower back's a big common one.
Okay.
We, again, with neck issues, we get a lot of neck issues. And then I think one of the most common, again, is knees and hips and ankles.
Yeah, ACL injuries.
ACL injuries and so forth. And the biggest thing with chiropractic, when we're dealing with the body, we deal with two major components. There's a structural component and there's a muscular component. And whenever you deal with the body, you have to deal with both components. If you only deal with one component, everything that you do is going to be short-lived. And with chiropractic, we're working with aligning the spine, aligning to where we have good mechanical function and balance. But if we don't deal with the muscle structure, then everything we do is short-lived. It's the same thing when we have a muscle issue and they do a lot of physical therapy, but they neglect the structural issue. The physical therapy is going to give them some benefit, but in the long run, if the structural issue continues to exist, then before you know it, you have the muscular issue.
I see. So,
again.
You're talking hip, and I know you got this model here. What can you show us on the model about the hip here?
Well, when we have, this is a model of the spine, and when we look at alignment, when we look at the spine from the front, the spine needs to be pretty much aligned straight up and down, and when we look at it from the side, there are three curves, one in the lower back, mid back, and neck. And when we have structural misalignment, say we have a misalignment of the spine where the spine is tipped like this, creating the pelvis to tip, you're now going to create imbalance with the lower limbs. You're going to create an irregular gait. The way they distribute the weight on one side versus the other side is going to be affected. In the long run, it's going to affect their ankle, their knee, their hip, and again, their lower back area.
Really, it connects everything all together, and it's really important.
Well, and the other thing with the spine that people need to realize is the spine houses the nervous system. So if you have a structural misalignment, besides causing a structural problem, over time you can begin to affect the nerves. And if you get a nerve that's affected and that nerve goes to a specific muscle group, a specific organ, and that nerve cannot function 100%, then that's also going to lead to other problems down the road as well.
I hear a lot that something as simple as having the right shoe or inserts can affect spine as well. How true is that?
Your feet are basically your foundation, and if your feet are not balanced, then it transitions right up the leg, right to the lower back and spine. Again, our body is like any fine automobile. And if you want a automobile to be able to perform to its fullest capacity, you want it running on 8 cylinders, not 7 cylinders. You want everything balanced. You want everything functioning. Our body's the same way. And if something's off just a little bit, it's going to affect the body in one way or another.
Right. I mean, you can't you have to buy proper shoes. You have to unfortunately, go out there and spend the right amount of money for the proper shoes.
Correct.
So that, your spine can be good and your hips. And,
Yeah, so
and all that.
everything has to be balanced. The biggest thing with chiropractic is, and especially with athletes who want to perform, is basically to perform to your fullest capacity is having flexibility, strength, and coordination. And that's what chiropractic really focuses on, is to allow the athlete to have all of those. So again, they can perform at 100%, not 98
yeah.
or 99%.
Yeah. Now, how early is too early to see
A chiropractor.
Yeah.
Chiropractor starts at very young age. Again, little issues it's just like the saying: as the twig is bent, so grows the tree. So as a child is developing, it's very important that we keep an eye on their spine to make sure their spine is developing correctly, so they don't have problems down the road. So chiropractic care starts at a very, very young age. Now, at a very young age, they see a chiropractor periodically. Now, if they're in a very physical contact sport,
Right.
then they will need to see a chiropractor more often, because getting hit in football is no different than being in an auto accident.
Right.
You know, and
I mean,
nowadays,
the impact.
And one of the biggest things we're seeing now too is a lot of neck issues, and especially with the sport of soccer, because you got a ball that's traveling at 50 miles an hour, and they go up to head it. You got to remember that neck is being compressed down, and we start seeing issues with the neck because of that.
Wow, very, very interesting. And that's why now in high school they're saying, okay, let's limit the headers on soccer, and even in football, the technology for that. It all affects the bone structure of a person.
It all
You
does,
know.
and it's a impacts that happen repetitively that create these issues. One impact is bad enough, but then you get an accumulation of those impacts down the road. It's going to create issues.
Wow. Now, for young athletes, are there signs and symptoms that they should be aware of to say, hey, maybe I need to go see a chiropractor or something?
Well,
Does something stand out?
yeah.
Or
A lot of times these issues can be asymptomatic for a while, but as soon as they start to have discomforts, they start having muscular imbalances, they have pain, and again, pain is the body's way of trying to tell you one thing only: something's wrong. It's not because you're deficient on some type of medication. You got to do something about
Yeah,
it.
so parents need to listen to their kids.
Parents need to
there's
listen.
a lot of parents out there that push and push, that trophy kid mentality, and they avoid the signs and symptoms that their kids are telling you, hey, my back hurts. Oh, suck it up and keep going. It's
Right.
not a good thing.
No, not at all. And especially with kids as they're going through their growth spurt, everything is developing. Ligaments become more laxed. Again, the probability of injuries go up too. So it's very, very important to listen to your body and don't overstress it.
Wow. I'm glad you mentioned that, growth spurts. What can you tell us about that and how the bones react in joints, and
Okay.
when does that happen?
Growth spurts develop throughout adolescent, all the way up to about the age of about 18 years old. And again, the bones are developing outward. And as the bones are developing outward, the muscles and tendons are constantly being pulled and stretched. And that's why you hear the people talk about growing pains. That's basically where the tendons insert into the bones. There's a lot of pulling on there, stress on it. There's a lot of irritation in that area because of the growth
What's
spurts.
the age that kids expect this or see this?
Well,
happen
you
at
got to
a certain
remember,
age?
we're growing from the time we're born until about the age of 18, 19 in regards to growing bone structure and so forth. Now, kids, especially during the hormonal changes, will go through that a lot quicker, and that's usually when they start to feel a lot of those symptoms.
Wow, interesting. It all there's so much information out there. But it's important that parents need to listen to the kids.
Parents need to listen to their kids. It's very, very important. And kids also need to understand being able to perform. It's not just, having everything that's balanced. It's getting adequate sleep. They need to sleep, especially during the growth spurts and so forth. They need to get out of sleep. And I cannot emphasize enough, nutrition is a big, big key with athletes as well. And one of the biggest things that we're seeing with kids now is posture. Posture plays a big, big role in regards to kids developing their spine, developing everything incorrectly too, because nowadays you have the posture where everyone's looking down.
Looking down at their iPhones.
And we have a word for that. It's called tech neck.
Yeah.
And what's starting to develop is a reversal of that cervical curve, which weakens the neck area,
Wow, interesting.
which creates problems down the road. So a lot of issues that I see with adults, young adults, are issues that developed when they were kids. They just didn't know they had a problem. Now it's been manifesting itself for a long period of time, and unfortunately now whatever damage has occurred, and a lot of cases you can't reverse that damage.
Wow, interesting. Well, there you have it. I mean, kids, now you have a reason to stay in bed longer. It's called growing pains. And nutrition, I've always learned the golden hour. Within an hour of any kind of training, you got to get some protein into you. So rest, nutrition, and pay attention to your body. What message do you have to parents out there for take care of the kids when it comes to bones and joints?
Well, stretching is a big part of it. Anytime a child is playing a specific sport, it's important that they condition for that. They get their body in tip-top shape for it. You don't want to just go out, do a sport, and not train yourself to be able to perform in that sport to your fullest capacity. The other thing is warming up before a sport.
Yes.
You watch any professional athlete, and before they go out and play that sport, the first thing they do is they stretch. They warm up. So I cannot emphasize the importance. You just don't show up at the field, run out of the car, show up and start doing your sport.
It's what we see a lot of.
We do. And the problem is the probability of injury goes up dramatically.
Yeah.
So, and that's the biggest thing I would tell kids.
Great. Well, thank you so much for being on the show.
Thank you.
Look forward to maybe talking some other time about bones and joints and stuff like that. And there you have it, folks. Take care of your body. Listen to your body.